About 3 million people. That's how many the American Cancer Society estimates gets a skin cancer diagnosis every single year. So when I noticed something red and a little peely on my nose that wasn't going away, I decided not to take any chances, especially after spending years in the sun without wearing hats and sunscreen when I was younger. So I asked Chico dermatologist Dr. Kefele Hadari to help me figure out what was going on.
It's not unusual to get various spots, red lesions, if you will. But the fact that it looks a little scaly to me and hasn't, has been around a while, suggests I think we should remove it.
Is that something like if somebody at home and they notice something on their face where it's like red versus peely, are there certain warning signs that you want them to pay attention to?
There are. Of course, I don't expect people to exactly know what's a basal cell and what's a hemangioma, etc. But I'd say if you have a new lesion or an existing lesion that's changing, that's one sort of strike against it. If it's bleeding, if it's peeling, if it hurts, those are all signs that you should at least let us take a second look.
Okay, so I mean, annual checkup, that's one good way just to kind of stay ahead of these things.
Yeah, no, that's a good point. I think in addition to all that, having an annual check, so putting those things together allows us to catch most things.
Okay.
Yeah.
And it's not always cancer. I heard you said hemangioma or something, right? So there could be signs of plenty of different things.
Totally, yeah. I mean, we want to rule out, and we're trained to kind of consider the worst thing.
Okay.
But most things aren't all that bad, and the biopsy is an opportunity to make sure to find out what it is exactly.
Okay.
Yeah, so this will be pretty straightforward. I'll have you rest your head back.
Okay.
I'm going to numb it. The numbing works pretty quickly. It doesn't feel great, but it's doable.
I'm ready.
And then we'll just take a little instrument, remove it, and go from there.
Okay.
We're just going to take our little instrument here and remove the lesion. Okay, so super simple, and I'm going to have my assistant Amanda get that all ready to put a Band-Aid on it. We should have the biopsy results in a week or two.
Okay.
We'll call you either way, and if it's benign, it's benign. We'll talk about that, and if it's not such a nice thing, there's ways to easily treat those too.
Okay, we'll cross that bridge when we come to it.
Sounds good.
All right, thank you so much.
Thank you.
All right, we'll see what comes next.
Yeah.
So I have a follow-up on December 15th where I'll find out exactly what was going on with the camera rolling again. And, remind your kids, hats and sunscreen, especially when we're younger, so important.